Hello. I'm going to talk to you today about a very dear place in my heart, something that's very close to my heart. That's working with mothers who have just delivered. During pregnancy, the stress of carrying a baby is huge. The body carries a lot of extra weight. The weaknesses in the body are exaggerated and made worse. And basically what happens is the pelvis goes more into distortion. During delivery, the chemicals come out, the pelvis spreads apart, and babies are delivered. That's wonderful. It also creates a wonderful opportunity or a bad situation. We can look at it two ways. The bad situation is now the pelvis comes back together in a random manner, usually further in distortion, resulting in back pain, slow recovery from the delivery, and slow healing. But now we have a mother that's debilitating to some degree, that has a wonderful new infant to go ahead and take out into the world, but tremendous pressures to go ahead and take care of that infant. And her body's not supporting her. There's an opportunity here, though. And that is when the chemicals of the body that allow everything to come apart are still in the body as it starts to come together. Cranial structural therapy, by working with the cranium, not even with the tissues that have been stretched and directly stretched or directly traumatized by birth, can bring the pelvis back together in a balanced way that previously it was not in. So actually it can be balanced even more than it ever was. Now, what does this mean? Well, one, it means that everything heals up better and stronger than it was in the beginning. Secondly, it means that the spine is supported for carrying that child, bending over, lifting, all the things you're going to go through. When I see a young mother with a beautiful young child that can't bend over comfortably because she's in pain, or is in pain from leftover things from birth or leftover things from carrying the child inside of her, then it's really sad, because this wonderful opportunity to bond and be with their child and be happy and joyful becomes an exercise in survival. And that's totally unnecessary if we can apply as soon as after birth as possible, by holding the cranium, not by working down in the pelvis that may be hypersensitive, techniques that will bring the pelvis into balance, bring the sacrum and iliums together into balance to support the whole spine and the whole body. So this is the opportunity. We need more people out there doing this, but people that work with delivery would be wonderful. But there are structural energetic therapists that have been trained to do this, and there are also cranial structural therapists and cranial structural energetic therapists that have been trained to do this. So the hope is that many people who are delivering will go and find somebody that can use this as an opportunity to bring their bodies together so they can be 100%, in fact, even better than before oftentimes, in taking care of their child, having support in their body, and having a wonderful, wonderful time. Thank you.